I am ADHD, quite happy to admit that. ADHD is a superpower in its own way because you have the ability to have these different trains of thoughts all going on at once. And the first time I took medication, they all sat down and I had this picture in my mind of these characters all sitting at a boardroom table waiting their turn to talk. And I could still think about those same things, but they weren't shouting over each other like a noisy classroom full of kids.
A very warm welcome back to the Pause and Reflect podcast, different space. Same thing today. Dr. Simon Dommett, welcome.
Thank you.
So last time we spoke about cat behavior, which was a really, really informative podcast. So thank you so much for that. It really resonated with a lot of the listeners. And a lot of the discussion with my guests happens off air, which I find really interesting. As soon as that cameras or everything's turned off, the lights are turned off, we get into really deep conversations. And we were talking about some of the topics that would be really beneficial, I think, for pet owners, particularly owners that engage in vet visits, would benefit from. And you said, what would be really good is to talk about us a little bit more as vets. And I've been thinking about this for a long time now. When did we chat before? It was a few months ago.
Yeah, a couple months. Yeah.
And every now and again I think, personality types of the people I employ, of the people we surround ourselves with, my own. And it's actually really got me thinking. So I'm delighted that you've offered to come and talk about ADHD, personality traits of vets. I think it's going to be hopefully quite an informative conversation. So very warm welcome.
Thank you.
So I'm going to start by asking, what do you reckon owners perceive as the typical personality traits of vets?
I think it's so varied. I think you've got clinics where vets are some vets are engaged and they feel like the clients feel like they're part of the veterinary family, and then you got those vets who've got quite a cold clinical demeanor, and that nothing's wrong with either of those, but we are also different, and some vets are always in a hurry and in a rush, and some vets have half an hour, 45-minute yakking consult with their clients. I don't really know what the typical vet is. They're so also different.
So, I often hear the comments, I love them because, they took the time to explain, or the contrast to that is that, they've got a terrible bedside manner. And I often go, and correct me if I'm wrong, but I often go, that person with the poor bedside manner is brilliant. They're clinically brilliant, And I've known vets with the gift of communicating and explaining things, and maybe technically they're not necessarily as good as the poor bedside manner vet. And so it's nice to have obviously a combination of it, but I don't think necessarily we're even aware of. Maybe we are aware of which category we fall into, but I don't think it's something that we necessarily have worked on before.
So I spent quite a bit of time when I was in final year watching which vets resonate well with the clients, and trying to figure out, because understanding that at the end of the day, that client coming back to see me is what's important. And in order for that to happen, when the client leaves, the client needs to be happy with what's happened in that day. You've got to be happy with you as a vet. They've got to be happy with the care that they received when they were there for the problem they came in for. And that's the clinical aspect. But it's quite important that they leave happy with their interaction with you to make them come back. So I spent quite a bit of time watching which vets resonated well with the clients and which didn't, and what set them apart. And one of the things was really important for me, and I spent a lot of time trying to get young colleagues, vet students coming through, to try and explain to them, your client has to understand the journey that you're on with the patient and understand the treatment plan and the process and the diagnosis. Otherwise, they're never going to buy in. Vets love to complain about what's the term? When client compliance, that's the term I'm looking for, where a client stops the medication, stops the treatment plan. Well, the most frustrating is they jump from one vet to the next. It's always disheartening for us when that happens. But usually that happens from a lack of communication, and the client has to understand what's going on. And in order to do that, you've got to take the time to explain what's the journey they're going through with their patient, whether it's just they're there for a vaccination, or like we're chatting just now about a cat with a blocked bladder. They have to understand the process of where the animal is, how it's got to this point, and then what we're going to do in the short term to fix it, and then what we're going to do in the long term to keep it from coming back. And then when they understand the whole process, generally they'll leave understanding the value of the treatment they've received that day. And if you just say, okay, your cat's got a blocked bladder, I'm going to unblock it, pick it up tomorrow, they're going to get a bill. They're going to think, oh, well, that sounds like a quick thing. They don't understand. And then, sure as nuts, you're going to send them home with the prescription food. They're going to feed one bag of the prescription food. They're going to come back 6 months later with another blocked bladder because they didn't understand it.
So you really got to get the buy-in of your owners, and there's an art to that.
Yeah, it's a communication thing. I'm sorry, I'm going to just
silence your watch.
Yes.
So you made a very conscious effort very early on, but we are witnessing every day what happens when there is a lack of communication. And
yes.
you can either adjust that and learn from it and do better. But there obviously are a lot of frustrations, and owners express that because I hear a lot of negativity. Like you say, there's a lot of vet hopping and there's a lot of negativity. And I think in terms of our profession, one of my hopes of this podcast is to improve the general public's perception of us as professionals. But why do you think that there is mistrust of vets? Do you think is it purely down to communication? Where is it stemming from? Is it stemming from the fact that we are all so different that we can't be categorized in one section and we can then work on those issues?
I think there's different facets to it. I think there's a lot of not understanding quite from the client's point of view. They're not always understanding quite the journey that we go through with each case too. And sometimes they think, oh, they're just trying to sell me this new drug for pain in my cat, and it's all about just making the money from it. Yeah. Whereas they don't actually understand. When we look at it, we look at it. All the vets will look at a case and try and look at the case and the client in its entirety, and that is something that some vets sometimes do have a failing of. They'll look at the case without looking at the human that's attached to it. But generally, all of us are really good at looking at the patient, looking at the human, trying to then make a plan that's going to be reasonable and improve the quality of life for the patient as well as the home environment and within the financial means of the client. And we don't always communicate that we're having all these thoughts and doing all these things. We'll kind of say, oh, here's a treatment plan for your cat. Meanwhile, we haven't actually, the vet maybe hasn't explained the other options that they've already ruled out in their mind. Okay, well, this treatment plan is not going to work for you. That's probably not what's going on. And so I think at the end of the day, again, communication probably is a large part of it. There's also a lack of understanding of quite often of quite what we do. We often get clients think, they'll just pop in for a quick chat outside of consulting times. Like, no, you can't really, because outside of consulting times, we're not sitting around drinking tea. Yeah. Now we've got a hospital full of cases that we now need to diagnose their problems and make treatment plans and do surgeries and all these sorts of things. So when we close for consulting, it's not because we're sitting around relaxing. That's when we get really busy. And then the nurses start running and we're trying to run around, get everything tied in a bow. And then a client comes in
behind the scene.
Yes. And we often have clients who walk in at 11 o'clock because that's when we're now doing our procedures and things like that. And a client will walk in and be like, wow, it's really quiet now. Can I get a quick word with the vet? And like, no, you don't want to see the chaos in the back right now.
Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers a 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today.
Yeah, and I think there's also that issue too, where the clients don't quite understand that the little tip of the iceberg they see in the front in the consulting room, in the waiting room, and it happens in the back is there's so much more going on every day. And, we all start early, well before consulting, so we can get through the patients that are already in hospital. Aspect that clients often they don't realize, they don't know. And we've got a hospital full of patients back there. So when we open doors at 7:30, we've all been going for ages already. Trying to get through the hospital patients and get treatment plans sorted out for them for the day. So when we start consulting, we can then focus on consulting because those patients have been seen to and sorted already. And that's often it's a part that we don't show to our clients enough, and we probably need to make more effort of
more transparency.
And showing them a bit more of what goes on behind the scenes. And especially in our clinic where the theatre is quite isolated at the back, which is where we're doing all of our work and stuff during the day, our waiting room really does look very quiet and still like nothing's going on. It's far from the truth. Our busiest time really does start the moment consulting finishes. Yeah.
So how does that impact you as an individual, especially in terms of, you made a very conscious decision very early on to try and improve your communication and try and get owners buy-in, and so that they were satisfied with the level of care that they were receiving. How does does the job, would you say, suit your personality profile, or do you find it a struggle?
So I think, well, a couple of aspects. I find it, I personally take quite a bit of pressure on personally when my client's not happy. So it's important to try and, I always try and, make sure my client is happy. So if the clients come in out of consulting times for a quick chat, it's always quite a pressure because you really do want to help them, but you're feeling all the pressure at the back. So that's
added stress.
It does add stress on. But that's me. I do get concerned about the customer satisfaction, but I am ADHD. Quite happy to admit that, and the chaos, there's not much better way to put it, of us juggling all these different things in a day does suit my personality type quite well. Being ADHD, you have the ability to think about different things all at the same time. You've got these different it's how my brain works, with these different voices going on all the time. And it's some people say ADHD is a superpower in its own way, because you have the ability to have these different trains of thoughts all going on at once. So
your brain's always ticking.
Yeah, it is. And so for me to be interrupted and go and do that for 2 seconds, then go back and do that again, it's not a problem, because when that's happening, my brain is still running on these different trains of thought at the same time. So being someone who kind of starts one task, like an A-type person who's starting one task, has to finish that task before moving on to the next one, it would be a challenge in our line of work where we are having to handle different things at once. And even when you're in the back and you're doing an ultrasound on this pet, the nurse is going to pop in and ask, with the treatment for that dog, can I do this? And then a receptionist is going to pop in and she's going to say, this client's just phoned about this and this and this. And you're invariably answering 2 or 3 different sets of questions at the same time. And you're doing that continuously for hours.
You're easily distracted.
Yes, yeah. Well,
so it's,
that is a bit of a challenge in itself because I'm trying to do the ultrasound. Meanwhile, and the nurse who's like working on this case with me is getting frustrated because I'm busy sorting out those two people at the same time and not dedicating my concentration and focus to her. Yeah. Yes. So easily distracted is also a negative. Yeah.
But going back, and I know that we're darting around our conversation a little bit, but you make mention, and we started the conversation by saying you realize very early on client satisfaction is critical, and you are very aware of it, and you take it quite personally if people are not satisfied, because you take pride in the fact that you're trying to communicate better and you're trying to provide a good service. Do you think that is part of the ADHD? I don't want to say issue because I also see it as a superpower, I must say. Do you think that's part of it, that deep feeling, that sensitivity when owners maybe don't see all the challenges and the effort that's going into managing these cases?
I don't know. I'd probably have to direct that question to my wife. She's a foundation-based teacher and she deals with ADHD a lot. So a lot of what I know, I've actually learned from her.
Yeah.
Maybe.
So I'm asking you that because I have an ADHD son, and we talk about it being passed down to children, and hopefully we'll get a chance to discuss that, especially as I know you have children of your own. And I agree, the superpower, that ability to hyperfocus, that ability to, despite being easily distracted, to multitask. I go into a room and it drives me crazy, but I'll go in and there'll be 3 screens. I mean, we have regulated screen time. I think my listeners have heard me say that before, but he'll have the TV on and the iPad, and then there'll be something else. And that ability, I couldn't do that. I think that is a superpower in itself, but that ability to multitask is beneficial, but that lack of wanting to complete things is also can be quite frightening, because the attention span to try and get him to say complete homework, or how do you find that in terms of managing cases? Is it good in the hospital that you work in because you're as part of a team? Do you think it would be different? And I'm asking you lots of questions in one, but do you think it would be different if you were sole charge of one practice and you were the only vet? Would you think that would be more of a struggle?
I think in our setting as vets in a clinic that's big enough to have nurses, the great thing is I've got a nurse to chase me. So when I haven't wrapped up a case, then the nurse can come to me, listen, you haven't finished this, you haven't charged it, or what are we doing next with this case? I forgot about that one. Okay, let's get back to that. But it generally, I think it's really helpful for our career, and I do find it is quite a strength, is to be able to be working on this case now, while I'm in this consult right now, and I'm focusing on this client, but this other voice in the back of my mind is busy thinking about the case I've just admitted. Yeah. And okay, I've said I'm going to run those blood tests, but what am I going to do next? What am I going to do if it comes to this or that? And then another voice over there is thinking, okay, right, so that one that we took x-rays of, what is going on there? Why was it? The elbow looks bad, but it's actually lame in the back. What's happening? And then the other voice at the back is thinking about, what am I going to modify the ICU cages and make this better? And then the other voice is thinking about, I'm going sailing this weekend. So...
So you're able to process a lot of things at once.
Yes. So there's a lot of voices going on all at once, which has been quite a journey for me recently to understand that about myself. But the great thing is that you do have this ability to be managing multiple cases at the same time. And although the 4 of me and what you're seeing outwardly, I'm working on this case, I'm constantly thinking about the other cases happening in the back, which is quite great, but then quite frustrating for the nurses. Sometimes I'm working with this case, I'm doing this ultrasound, and I suddenly say, hey, that dog in the back, can you give it that injection? And they're like, where did that come from? Meanwhile, there's a different track going on the whole time, thinking about other things, and we'll often say, okay, well, put that dog away for now. I'm going to do this, and I'm going to ruminate on that one. And I don't think, sometimes the nurses who I work with don't get me sometimes, and that they'll think, okay, well, he's just ignoring it for now. No, I'm not ignoring it for now. Part of me is calculating it and taking the time to process the information while I'm doing something else, because I can do them both at once in a way, which is one of the ADHD superpowers.
And are they aware? Are they aware that you are ADHD? Are they starting to understand the benefits? Because with some of the frustrations come the benefits of going like, I've just had the most phenomenal idea.
They know because I start projects and don't finish them. They'll find bent paper clips all around the place. Things have been picked up and put down somewhere. So they all know I'm ADHD. The signs are very obvious.
So we're talking obviously the practicalities of saying, there are certain things like consults that we naturally have to wrap up, give medication, and then things that happen have got to be discharged. Lovely in an environment where, particularly from my understanding for ADHD, you get easily bored. You're always looking for something to occupy your brain.
Yes.
So quite nice from a professional perspective to have those mental challenges every day.
And that is exactly one of the main reasons why I went into veterinary was because my father was a vet. He was farming, but I did get to go out with him a couple of times to see patients and see clients, and sometimes a friend would bring an animal in to be seen. So he wasn't practicing, but I did get a chance to see the veterinary world growing up. And then he encouraged me to spend a lot of time with practicing vets to see what it's really like. And I think I have a mind that's actually quite suited to engineering and so on. So I nearly went down that route. But at the end of the day, veterinary every single day is so completely different. I had a human GP yesterday ask me, we do swimming together, and he said, so what's your day looking like? And I kind of want to turn to him and say, I've got no clue what's coming in today. And it doesn't matter what the bookings look like, because what's coming in has got nothing to do with that. It's going to be crazy in some other way I can't expect. And that is one of the wonders of our job, that it can obviously get very tiring. But every day is extremely varied. And it is one of the things that makes the job for me and my personality really enjoyable, is because you don't really get bored. No. And you can fill it with, and then when you do have quiet times, that's the time when it's time to catch up and read a bit more and re-educate yourself, because in our profession, you never know enough. Absolutely. You're constantly trying to keep up with the latest in that and treatment plan for that. And I had the case last week that I wasn't so happy with the treatment plan that we used, even though that's how we've always done it. Let me look up and see. And you find some article, and next time I'll do it, add this medication regimen, or,
So true. So how do you manage the impulsivity associated with your ADHD?
So that's a interesting journey that I've been on quite recently. I've always been quite self-controlled and had a really good self-motivation. So through school, I was fine. In hindsight, maybe I could have done this medication. But in the generation that I was in, the ADHD medications were limited, and the side effects generally were not ideal. Some kids were fine, but my brother was on ADHD medication for a while, and the side effects were really not great. He wasn't great on the meds, and it was even worse when they wore off in the afternoon. But there weren't many options back then. But now there is a lot. It's a very different scenario now. And I didn't really realize what the negatives were until I tried medication myself. So about a year or two ago, I think about a year ago, my son, we were battling with impulse control with him. And it's all the same signs of ADHD that I had. And just like me, academically is not a problem. In the classroom, actually, work is fine. The problem is the impulse control, particularly. And you can actually see it when he shouts out and answers a question that he shouldn't, or he spontaneously does something to irritate one of his friends because he doesn't have the self-control to stop himself. And immediately there's that regret of, why did I do that? Like, now I've irritated him. And he can't help himself. And we're seeing this social interaction being affected by his condition. And that's what led us to say, okay, we're going to the teacher. Listen, this is what we're seeing. What are you seeing in the classroom? And she's like, yeah, it's a bit in the classroom, but he's bright enough that it's never going to bother him as far as academics go. But I see it in the playground. Like, well, that's exactly what we're seeing with friends. So we after a while, we went to the doctor and started the whole journey of going through ADHD medication. Mainly because of that, the emotional regulation and the impulse control. And when we're chatting about it and chatted with the doctor, I said, well, I've been ADHD my whole life and I'm fine. But I do see the same signs in him. So he said, well, go on a trial. Try it. See if it affects your life. And if it does, which I'm telling you it's going to, then you're going to learn a lot about yourself. And if it doesn't do anything for you, that's great. That's not a problem. And it was a fascinating journey, because I'd always been told by my wife, who's a foundation phase teacher, been told by doctors who are friends who are GPs, that the sooner you start ADHD medication, the sooner you can learn to cope without it, and the child doesn't need it anymore. And I'll be absolutely honest, I thought this was nonsense, especially coming from a medical background. We, quite often, a lot of drugs, you start medication, the patient gets used to it, the body wants it. You take their medication away, the body's just going to want it. It's going to have that help. You can't start heart medication and then take the heart medication away.
Yeah.
So I had very much that sort of outlook, and I must say I really didn't believe it. And when I tried the medication, it was, I was proven wrong immediately. So I think I'll explain just now what it was like when I took medication for the first time and why I saw these things. But the one thing is that by day 3, I remember quite clearly, by day 3, I looked at myself and I thought, okay, now I get it. I now understand the way my brain is supposed to work. And I can now understand when I'm off medication that I need to keep myself regulated in the same way. And I finally truly believed what they were saying about, no, the ADHD medication is there to help you to learn how you're supposed to regulate yourself, so that when you're off the medication, that's how you're supposed to be. And then you can feel yourself that, okay, hang on, no, things are not working the way they're supposed to again. It's time to take medication again until you can get yourself controlled. And I was on medication for probably about 6 months,
okay,
on and off. And I've now been without medication for about 6 months. And I feel fine. I feel the same way I was when I was on medication. So I do believe that it teaches you to control your brain or manage your brain and your feelings and your emotions and everything the way that you should.
So it gave you an idea of what it would be like not to have the condition. And
Yes.
then is there now a desire to seek that same feeling through other means? I mean, have you found, you're not on medication, but have you found other coping strategies like meditation and cold plunging and improved nutrition and sleep and all the things that they say should go alongside managing those?
Yeah, so what happened with me was when I was on medication, okay, I got this point, and then I went off medication for a while, and I thought, I'm not having that same control of my emotions and impulsivity that I was. So I went back onto medication again. Then I'll be honest, after being on medication for a while, some of the side effects were starting to get to me, because even I was quite lucky early on. I found a medication that suited me really well, but there still are minor side effects, which is, as an adult, is quite easy to see. I mean, as a child, it's not as easy for them to understand. But then when I went off, on and off a couple of times, I suddenly realized, hang on, I get the same, now that I know, and it's only through the help of the medication that I know how it's supposed to be. I get the same level of self-control and calm within myself when I am exercising a minimum of 4 days a week. And I'm not saying that's the answer to ADHD, but for me, that is what is working for me. I need to exercise 4 days a week. 3 days a week is a minimum, but 4 days a week, and I feel the same as when I am on methylphenidate. So for me, that's
managing your dopamine. It's your dopamine release.
It really is. And there is a fair amount of endorphin addiction there too, I think. I am one of those. But that's fine. I've learned that about myself. And now I know if I have one of those weeks that's hectic and I can't get to exercise, I start struggling with work again. I start struggling with impulsivity, and then it's harder to get to bed in time, and then the whole thing starts to unravel. And so I need to make the conscious effort of get up, go exercise before work, or trying to exercise in the workday is quite difficult. But it's critical for me, and I think my family's also come to understand for me how important it is. And by keeping that up the last couple of months, I felt really regulated and fine. So that's been quite interesting.
I mean, then there was such a stigma. You talk about historically your brother struggling and going on medication. I know historically there was such a stigma associated with being ADHD. It was the troublesome, the poor learners, the kids that you wouldn't want to associate with necessarily. And I when my son was diagnosed, I knew very early on that this child was busy. I didn't quite put a label on it at that point. But the ability now to understand the way his brain works allows me to manage him differently. And I have to say manage. He's brilliant, and he's got the most phenomenal sense of humor. And there's so many great things about having a mind that works the way it does. But I think that understanding, and I think helps that we do think laterally. We do try and find other solutions. I think that's, we're trained to do that, but I think naturally as vets, we go in, and that's why we work well as vets, because you have to think like that when you're managing cases. But having the ability now for you to say, okay, I've seen the fog is cleared, or whatever analogy you want to use. I know how behaviorally, whether it's exercise or adequate sleep, or even a combination, like that multimodal approach that we talk about with bad skin cases, to now keep yourself on track, and impulse, and the emotional regulation, and the social benefits that come with that.
Yeah.
Do you recognize that in your colleagues? Do you recognize the same kind of traits? Is it easy now that you understand it to spot it in other people?
Yeah, definitely. And looking back at a lot of my friends I studied with, I look back and I can also see those that were ADHD that probably the same strengths and weaknesses that I hadn't realized, and colleagues I've worked with more recently that also are the same and have had their journey with medication that has helped them, and sometimes, and I can also see when they're on their medication, when they're off their medication, because you start to see their strengths come out, and and particularly sometimes with the medication that's maybe not so well balanced, because you can see, okay, well, they're having those issues again. That's generally when that person's on the medication, they're struggling with those emotional things, but then when they're off the medication, then we're struggling with these tasks and getting the person to get through the day and get things done. So, but and on that note, seeing when the medication's not quite working for someone is quite a challenge. And when we've had that with my son, we're on, I think, our third different or fourth different medication now, and also, as you grow, you change. So the first set of meds we were on with him were great for a while, and the second set of meds, that was a disaster, and we saw that quite quickly. The third set was all right, but we were having some emotional challenges, particularly later in the day, and I think that's something that I quite like to talk about, having been through this journey, knowing what those feelings are like as an adult. I can easier see it in my child, and I can understand it. And being a parent who maybe doesn't understand that would not understand where those feelings are coming from in the child. So that's quite a thing. And then now we're on a new set of meds. We've only been on the last few days, but things seem to be getting better again. And so when the second set of meds that I had tried was very fascinating for myself. I my son had been put on a new type of medication. It was a long-acting of what he'd been on before. So theoretically, same, right? And I'd been taking top-up doses. So the doctor said, well, you can try the long-acting one too, see if it works for you. As an adult, it's easy to take top-ups during the day. It's not for a child. So hence the reason I wanted to change to long-acting. So, it's exactly the same as what I'm taking. So I'll just take a lower dose just for the first day and then go up to my normal dose the next day to wean into it. But it's long-acting. It's exactly what I'm taking. Disaster. Absolute disaster. I don't think I've ever felt so out of control of myself as I did that day. It was awful. I remember I was making a cup of tea and having this absolute uncontrolled rage building up in me. The teacup didn't offend me. There's no reason for it at all. And then later on in the day, just utter unconsolable sadness, like I wanted to cry. For no reason, out of the blue, absolutely nothing, bring it on. And these emotions are just all over the place that day. And that same medication did have the same effect on my son, which also tells you a lot about genetics. And he was just sitting on the floor one afternoon and just sobbing and crying. Just absolutely unbearable, just crying for no reason. And his emotions are also all over the place. Okay, well, that didn't work. Which is so interesting because on paper it should be exactly the same responses which the meds we were taking, and it was just terrible. And now, and seeing the medication that's recently we've just moved away from, I could see the same, but in a more subtle way, at certain times of the day, just his emotional response being inappropriate, and that's just the medication not being right. So we once again went back to the teacher. What are you seeing? Okay, cool. Go back to the doctor. Listen, this is what's happening at school. This is what's happening at home. You get one of those forms with a million boxes you tick in, and you get surprised by the answers. It's more in that category than I expected. And then just being frank with the doctor, like, right, this is actually what's worrying us. These are the emotional things we're seeing. We're getting a child who's super polite and well put together, who's suddenly back chatting and being fighting us at home inappropriately. Well, it's time to go brush our teeth like it is every time. No, I don't want to brush my teeth. Okay, where's that coming from? So those are the things that were creeping up. So then talking to the doctor, and he'd okay, great. Well, these are the side effects associated with this medication. So yes, that is coming from that medication. That's not. That's from that. That's from that. Okay, cool. So then, right, the next one we're going to try is this. If this doesn't work for this reason, I've still got the next one and the next one.
Yeah.
And
it's a bit of a journey.
Yeah, it is an absolute journey. And part of it is finding what works for you, because the nice thing is there's so many different options out there now, and they are all different, because we're all so different. And part of it is especially a child growing up, he's changing month to month. There's a different brain chemistry there. So the medication is going to need to change as he grows, and that's the journey we're on. And that's absolutely fine. But
what would you say to either adults with ADHD or parents with children with ADHD who are fearful of using medication?
I think we grew up with such a stigma, because there was a stigma about being an ADHD child, and there was a stigma with the medication, because the initial medications that were around when we were young were often really strong, with really strong side effects, and it was a big connotation. So our generation is really hesitant. And my wife, being a foundation phase teacher, she meets this resistance from parents all the time. And I think what's important to know is that there's nothing wrong with trying the medication. You're not going to permanently do any negative effects, when the meds wear off and they're out the system, they're gone. There's no negative changes. And it's with the help of a doctor, you can try, and you can always try milder things first. And quite often the doctors will suggest some lifestyle changes before even trying medication. They'll go through diet. What are you feeling good for breakfast? Well, Choco Puffs is probably not the best thing to be giving them before school. And not understanding why they're having sugar highs and sugar lows in the classroom.
And that's very typical. I mean, going back to our profession, that, when you're busy and you're new grad and you're popping out, you're eating what you can on the go, your surgeries are long. I remember first qualifying, and we always had a plate of biscuits. And I thought, like, this is the best practice to work for. Not only did I gain weight, but that sugar, by the end of the day, everybody was crashing. Yeah. So, having a better understanding of good nutrition and maintaining your energy levels, ADHD or not, can be really valuable, and particularly obviously when you see that impact on a child.
Yeah.
I want to not lose the opportunity to ask you, because obviously there's a lot of talk of burnout within our profession. Do you think that this situation is compounded by the fact that perhaps ADHD or not, I know we started with that conversation of different personality traits and are struggling with different things, and having the stress of maybe being misunderstood by some. We've got some wonderful owners. I'm not grouping them into a category, but not always being fully understood in terms of what our job entails, having to charge for our services, and so on and so forth. What do you think for you personally, that burnout you spoke about, just how awful you felt when your medication was not in control? Do you think that's a contributing factor, that there are a lot of vets out there that might need some help, whether it's meds or behaviorally or psychologically?
100%. I mean, a lot of that comes to brain chemistry at burnout, in a clinical way, and I see that in myself. The phases where I've struggled more are the phases where I've not been well regulated, and going through the ADHD medication process has taught me about myself and taught me when I'm regulated and I'm not. And I haven't had those struggles now that I know how to regulate myself better. But before that, I did have phases where I was feeling burnout. For me personally, depression, going through being a teenager. I think it's quite a normal process. Most teenagers will face some level of depression, and that's kind of the brain chemistry changes that we go through as humans. But as an adult and in the working category, I think I faced depression is sort of a manifestation of burnout for me at phases. And being a self-motivated person also sort of helped me to know I need to sort myself out and make sure that I don't spiral into that. But we've seen it so much in our colleagues and friends how that happens, and that I think all of these issues and knowing how it feels when my brain chemistry is not right has taught me, opened my eyes to exactly that. And for me, like I was saying earlier, when I'm not exercising enough, things start to unravel. Then my ADHD symptoms get worse is one thing, but more seriously, I start to get more tired, even though, you think, I'm just
too tired to exercise.
Too busy this week. Adding another thing like exercise onto my plate is going to be more tired. So, and that might be true to skip one session, but the moment I've skipped exercise for a couple of days in a row, that's when I start to spiral out. And it's very subtle, but then I start to get tired. And then I start to lose motivation. And then I start to not sleep as well either. And being an endorphin addict, then that gets taken away from me too. And then things start to change. And then it's harder to get back into it again for me, and harder to get back into the routine. And I can so easily see when I skip a week of exercise, I can so easily see how burnout is just another week or two away of not looking after yourself. And for me, I found a way to control my brain chemistry without medication, and that's great. And I fully understand how that's not achievable for everyone. And there are some medications that are necessary to keep your brain chemistry balanced for some people, and that is not a problem. That is just the way it is. That's the way you are. And for us to keep functioning at the level that we need to keep functioning at, then some people do need help to do that, and that's fine. There's not a problem with that, and there's such a stigma about that, which there shouldn't be. But then I've walked this journey where I found a way to control myself without medication, which is really great. So I'm quite open to suggesting that quite often with diet and healthy living and exercise, you can control your brain chemistry really well for a lot of people. But once again, there's some people who will need help, and that's fine.
But do you think more vets should take responsibility for managing those feelings because there are solutions to it, rather than leaving the profession, for example?
Yeah, I think the nice thing about our profession is there's so many opportunities that you can go into other than clinical practice. But yes, maybe leaving clinical practice isn't your only option. And we've got we're really lucky in our area. We've got a wonderful lot of GPs in our area. And it's quite nice to, and I think it's something that we as vets don't go to the GPs very often because we think we know everything. But I go to the GP fairly often. I said, this is how I'm feeling. This is what's working for me. This is what's not working for me. I'd like to think about changing my medication, and it's great to have walked that journey with them. And like I said, I've battled with depression on and off quite a bit in my life, but I haven't had to seek medication for it because I've managed it in other ways. But I think that our profession particularly don't go to our human medical colleagues often enough. And they, this is what they do. This is what they're dealing with more than anything.
Yeah.
We speak to my human GP friends, and they're dealing with depression, ADHD, and these emotional challenges multiple times a day, every day. They really know their stuff. And I think we need to be more willing to go and
get some help.
Yeah.
And finally, because I have had questions about this that I want your opinion on, that difficulty of dealing with the roller coaster every day of the euthanizing a pet and being involved in that, and the difficult decision making and emotions from our clients and pet owners, to then going and switching your puppy consult next, and happy go lucky. How do you manage that, especially because from what I understand, particularly with my child's ADHD, that emotional regulation, like you say, that sensitive, he is a deep feeling child. Yeah. It's part of the condition. Do you think that is harder for a vet with ADHD?
I think yes. So yeah, firstly, the one thing I think our clients really don't get is that, yes, it is sad for us when we having to euthanize a pet, we're having to deliver bad news. It's really hard. And we then have to walk out of that and immediately talk to the next client with a smile on our face. And it's important that every client feels like they're the only client of the day. And we don't want to portray our baggage from the previous patient onto them. And it's really important that we shouldn't. But that flicking that switch and putting those emotions away is very taxing. And I think that's a big part of burnout too, is stuffing these feelings in a bag to deal with later. And putting them behind us and putting on a face, a mask onto the next client. And I think that adds up to our burnout in our profession quite a lot. But yes, as an ADHD person, I do think that regulating those emotions is harder. So the first time I went on to medication, and at the end of the day, the first medication I went on to actually turned out to be the one that's regulated me the best. And I've tried other ones and gone back to it. So that was a lucky hit for me. But my first few days on medication was just so eye-opening. And I really didn't know how little control I had over myself until the medication showed me the control I should have over myself. And that was what was fascinating. And that's what made me realize that I can learn to function at this level without medication. Because now I know what's expected. I should have this control over myself in terms of emotions particularly. And without the medication, I would never have known that actually I shouldn't be subject to my feelings. My feelings, I can control whether I that sadness is there, but I don't need to portray that sadness and let it out. I can have that sadness inside and control it. Or anger. And that was quite a thing for me. I'm someone who avoids confrontation because, and on medication, I'm quite different. But even now when I'm regulated, I avoid confrontation because I don't want to get angry and then speak out of anger because I can't control my emotions when it comes to anger.
And historically, you were impulsive, so that would be a compounding.
Yeah. So I avoid confrontation big time. I will walk away out of an argument. I cannot understand. There's friends of mine who did debating at school. It makes no sense to me because there's no way. But the moment I took medication and I could see how I could control my emotions, the other thing was it did make me actually have arguments in the workplace that I would never have had before because I knew that I could control. It was really eye-opening. But the first day I was on medication, the biggest eye-opener for me was we spoke earlier about how there's these different trains of thought going on in my mind all the time. I'm thinking about this and that, and there's these voices shouting in my mind all the time. This one's talking about this case I'm trying to focus on. That voice is talking about that other case that's in the back. That one is talking about sailing, and then that one is talking about the cabinets I'm trying to build. And they're all talking at the same time, shouting, and I'm just trying to get through the day, focusing on this, and it's very tiring. And the first time I took medication, they all sat down. And I had this picture in my mind of these characters all sitting at a boardroom table, waiting their turn to talk. And all the voices were still there. And I was still able to think about all the same things. And it did not take away that ability, but it made it happen in an orderly fashion. And I could still think about those same things, but they weren't shouting over each other like a noisy classroom full of kids.
So not interrupting.
Exactly. Yes. And it didn't, and a lot of people say, but you dull your emotions. It didn't dull my emotions. I could control my emotions. I could control my thought process, which is so interesting. I didn't know that you could control your thought process so well and decide, okay, this is what I'm focusing on. And as an ADHD person, you mentioned earlier how your son can hyperfocus. And when you find you get into the zone as an ADHD person, you really hyperfocus and you don't know anything about the world that's happening outside. But then when you're on the medication, you realize that I can choose what I want to hyperfocus on. So at one stage, I was doing quite a bit of admin work, which would normally just be absolutely horrible and not fun, and typing emails and the kind of stuff that I struggle to get through. And I could apply the same amount of focus I would to that as I would as when I am doing a surgery or something that really hyper focuses me. And I could get through that admin work really quickly. And I can also see how people can abuse this medication, which I saw at Varsity, people inappropriately taking medication to help them with exams, which was not healthy and not good. And I do not recommend, because there were people who didn't need it were doing it. But I get how it's helpful, because I could choose when to hyperfocus, which was so fascinating. And then now, having gone this journey, I could, like I said, by day 3, I could see, all right, I can understand how with the medication I'm like this, and how I can control myself to be the same person without the help of the medication eventually, with enough time. And for me, that, like I said, was about 6 months of being on the medication. And now I feel like I have that same control over my thought process and emotions. And it's been really fascinating. And I can control those emotions. I can go from the consulting room where I'm really bummed. I've just put McDougall down, who walked a long journey of liver cancer, and we've kept him going for ages, and now it's finally time to put him down. And that's terrible. And my routine, we've probably all got our own rituals, but for me, I'll say goodbye to the client. I'll sort out what I need to sort out with the patient, and then I'll clean the consulting room table. And it's a bit of a ritual thing. And for me, that's I'm wiping away that. I'm sorting it out. I'm putting it in the back for processing. And when the table's clean, it's time to call in the next client. And ready for the next one. And it's not that those emotions are gone.
Or suppressed.
Or suppressed. They're still being dealt with appropriately, but I can put a smile on for the next client and move on to the next client. And I think that is something that's taught me a lot. And then I think, like you said, maybe a lot of our colleagues don't know how to process those emotions right. And maybe more could help with a journey of self-discovery like I've been through with the help of our human medical colleagues.
And my final question for you, because I know that we could do a full podcast on this topic, addiction in the workplace. So, we spoke about not necessarily managing yourself. And the easy thing to do is to say, go home and open the wine. Or, hey, like I'm feeling, desperate here.
Yeah.
So I'm talking, and I want to give you my personal take on it. One of the reasons I did not want to start my child on medication is I was very fearful, having had addiction issues in our family, of setting up a child who then was going to be addicted. You hear about the kids abusing it. You just made mention of it. I was very fearful of addiction. I was very worried that I was introducing something that he potentially would become addicted to. But not only would I like your opinion on addiction to ADHD medication, but the consequence of not managing yourself correctly and having other addictions, because, like you say, you're burning out, you're suppressing, you go home, you open the wine. It's an example if we're talking about alcoholism, but there are obviously very serious addictions amongst all professions, but particularly high stress professions.
So I had exactly the same reservations when we started this journey with my son, because I had that opinion that, no, you're going to get addicted to this drug that makes you get through a day easier. And which is also part of the reason of why I was open to trying the medication at the same time as my son was trying it, which is a pretty cool journey to have as an adult. And I would recommend to other parents who think they're ADHD, or if your child's going to go through it, talk to your doctor about you doing it too. Just out of interest, you might learn something.
Absolutely.
And I did.
Helps to be female and not have the impulse issue like my son. But there's a lot of things that I've discovered about myself in the journey of, and I think, you look back and you go, I wonder if I had been managed differently, where I'd be today, or how I'd be, whether some of the decisions I've made in my life from a personal perspective would have been the same if I was aware of some of those things.
So I always had the same reservations about addiction to ADHD medication. And within a few days of being on it, I think those fears pretty much went away. And I realized, it's a pretty cool feeling when you can, like, your brain does kick into that hyperfocus. And the cool thing is, unlike with ADHD, you can choose when to hyperfocus and when not to. And that is a nice feeling. But with the medication comes a lot of emotional regulation and so on. And it teaches you how you should be. But for me, it was also, I don't want the drug to be doing this to me. I want to be doing this to myself and controlling myself in this way without it. And so I was worried about addiction, and I come from a family with quite a bit of addiction problem too. So was also hypersensitive to it and really, really weary of it. And for myself, I've always been super careful, because they say that so much of addiction is a genetic trend to it. And I don't quite know the ins and outs of it, but it certainly seems like it with the family history like I've got. And so I was very nervous, but definitely within a few days of being on the medication, I realized this isn't the kind of thing that I would find likely to be addicted to. This is something that, okay, I'm learning, I'm seeing how this makes me better, and I want to be like this without taking a pill in the morning. And I don't, I certainly, it's changed my opinion of it hugely. And like I said earlier, I was one of those people who did not believe that going onto medication at a younger age would help you to get off medication as you get older. And now I now believe completely the opposite, is that you learn how your brain should be running, and you can learn to control your brain at this level without that help.
And without resorting to other things to help you soothe.
Yes.
Unhealthy relationships, alcohol, negative situations. It's possibly a solution to.
So I think the thing is that when you walk the journey that I've certainly walked with ADHD, it's made me very aware of when my brain is regulated and my brain chemistry is regulated and when it's not. And so when I can see bad tendencies coming in, I can see that my brain chemistry is not regulated, and that's not how I want to be, and that's not the person I want to be. So it does make you more aware of your mental health in that way. And so I think going through this journey has made me less likely to be falling back on bad habits like that. And in our workplace, it is something we see a lot because we often work long hours, we work with stress, and we also have days where I think yesterday the theme of the day was irritation.
Irritation.
We have themes of the day. Some themes of the day are this is a poo day because everything's a poo case. Well, this is a vomiting day. All the cases are vomiting cases today. So yesterday's theme of the day was definitely irritation. It was clients coming out of their appointment slots. It was cases coming that were booked in as one thing, came as something else. It was, all these little things, and each one is like, it's a bit of an irritation. But when they start adding up on top of each other, at the end of the day, we were exhausted from being irritated by little things the whole day. And so these sorts of things compound, and I mean, most careers, but I think our career particularly, we have days like that where you are just so worn out at the end of the day, and then it's been long hours, and I didn't get sleep last night because I had call outs last night, and so I really can see how easy it is for people in our profession to fall onto addictions and things like that, and being aware of mental health and not only ADHD, I'm talking about mental health generally, is so important so that you don't get into that mode. Because I can see how easy it would be to happen.
Absolutely. Thank you for sharing your journey. It's a very interesting conversation. I hope one that both owners and our colleagues can relate and resonate with. It's a reality of the work that we're doing and the environments we find ourselves in. So I think it's important that we have more information and we are having these discussions because, like you said, if you had the awareness even at a younger age, we definitely find ourselves in a position to manage things better. Thank you, Dr. Simon.
Thank you for having me.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.